All right, guys, thank you for coming again. We're going to talk about critical thinking in an outpatient setting. Most of this stuff you already know is just kind of review, okay? First, we are going to do our cognitive objective, which is correctly identifying critical vital signs. So let's go over the vital signs. The newborn heart rate, which is 0 to 4 weeks, the heart rate should be 100 to 180. So for most of us, that seems like a lot. Especially for new parents, when they come in and they see a heart rate is 160, they get concerned. So it's important to just reassure them that it is okay. The respiratory rate is 30 to 60, so that again can look different. And it can look like they do a lot of belly breathing too, so it's even hard sometimes to get an accurate respiratory rate on an infant. The systolic blood pressure should be 50 to 70. And again, for me, coming from an adult world, 50 to 70 seems so low. So it's important that we realize that also. And weight is anywhere from 2 to 3 kilos. For an infant from 1 to 12 months, the heart rate is anywhere from 80 to 160 range. And again, that's a huge, huge range. So it's important to listen also, or to have the provider listen to make sure that it's a regular rhythm. Respiratory rate is 20 to 50, again, huge range. Systolic blood pressure is 70 to 100, so it's a little bit on the more normal side, what we're more accustomed to seeing. And weight in kilos is a huge range, 4 to 10 kilos, so that's anywhere from 8 to 25 pounds. For a toddler, which is considered 1 to 3 years old, the heart rate is 70 to 150. With a respiratory rate of 20 to 35. The systolic blood pressure is 80 to 110, and it remains 80 to 110 from 3 to 5 years old too, so it's 1 to 5. And your weight in pounds is anywhere from 10 to 14 kilos. Preschoolers, 3 to 5, the heart rate is 60 to 120. Still a high range, because adults are 60 to 100. So it's one of those things you have to kind of have your nurse's intuition and see if the patient is symptomatic or not. Respiratory rate's 20 to 30, and systolic blood pressure again is 80 to 110. For your school age kids, which is 6 to 12 years old, the heart rate is 60 to 110, as well with your respiratory rate of 15 to 30. And your systolic blood pressure starts getting to where we consider an adult. It's 80 to 120. And your weight is 20 to 42. And then for 13 years old and older, which is adolescents, heart rate is 55 to 110, with a respiratory rate of 12 to 20, and a systolic blood pressure of 100 to 120. So once they get to 13 years old, you start looking at it as an adult's vital signs. With all of these vital signs, everything is variable. So you have to consider your assessment also. If they look like they're in distress, if they are having trouble breathing, if they just don't look right, it may be a good idea to reassess them and check their vital signs again. So what are some critical values that you think? So for a newborn, if a newborn, say 3 weeks old, comes in and their heart rate is 59, what would be your first step?
My first step will be to recheck it, probably manually, just to double check that it wasn't a machine issue.
Right.
And then if it's consistent with what I got with the machine, then I will definitely notify the provider.
Yeah, that is exactly what you should do. Because the machines, we start to rely a lot on the machines. And a lot of times it can be just a number and you don't think about what that number truly means. If you had a heart rate of 180 in a infant, that's normal, but you would probably want to do an EKG to make sure that it is sinus rhythm. Now, EKGs on infants, as I've learned these past 4 months, is very, very hard. But sometimes you can even get just a rhythm strip with the 3 leads, just to make sure that they're in sinus. Because a lot of times, even if they're not here for a cardiology appointment, they could be here for a GI appointment and they're not eating correctly, so you never know what other symptoms can be exhibited or shown at that time. How about a 13-year-old with a blood pressure of 70/50? So here it says that the systolic is not normal, but if they're athletic and aren't here for cardiac issues, aren't having trouble breathing, aren't having, aren't getting winded, then it may just be their norm.
Yeah. So that's one thing I always ask. I'm like, what's your normal? Because some people don't know, but a lot of other people do know.
Right, and if it's not their first visit, you can always look back in their chart too, to see what they have been kind of running. Same with oxygen saturations.
Yeah,
Y'all see tons of oxygen low O2 sats. And in the adult world, you don't see that unless they're like a COPD patient or something. So for me, that's something that I've had to become accustomed to, is if they come in with, a 92, I don't start freaking out, being like, what's going on? Because a lot of these patients have comorbidities and congenital things that will make their heart or their O2 sats be low. So that's a good point. You just have to kind of check and see what their norm is. But if it's a new patient that's like 4 years old comes in and doesn't have anything congenital and their sats are 90, we're going to be concerned, right? We're going to be like, well, what's going on? And one thing I found with infants too is that it all depends on where you take it, because they're so wiggly and they can be so complicated to try and get that. One of the things that we have talked about for the other clinic is getting nose probes. They're like nose clips that they use in the OR. But you can put them on their ear, you can put them on their nose, anywhere that is going to, like basically anywhere on their body. But right now it's only an OR thing, but it would be good for these infants that are so wiggly you can't get it around their foot, or, so like I said, I've been thinking about it, but haven't been able to do it yet.
Sometimes people just do the pulse ox real fast. And I like
They don't let it read.
Yeah, they don't let it read. Like I just leave it on the finger and I do other stuff and then just wait a minute or two and then it usually goes up. So I've seen other people just do it for like a few seconds and then just take that first number, and that's not their
Right.
number.
Right, that's a lot of times if somebody comes in with like a 97, just a normal teenage kid, I'll ask them to take a few breaths, and then usually it'll go right up to 100. One thing that I've thought about recently, being new to the congenital world, is there's a patient that has, she doesn't have insurance. I'm sure y'all know who I'm talking about. And she has come in a few times, and she needs surgery, and we can't offer her surgery because she doesn't have insurance. But her SATs, she's blue. She's blue lips, blue, starting to club. And her SATs are like 68 to 72 every time she comes in. But for me, using all of the knowledge that we have, it can't be but so accurate. Like her core O2 sats are not 70 something. But when you get it on the finger or you get it on these places that are having low perfusion, that's the number you're going to get. So you kind of have to, the only